And now we begin with our leading story. Medicine Sans Frontières, MSF, also known as Doctors Without Borders, says it has treated 17,000 people after setting up around 30 units and treatment centers in the Democratic Republic of Congo, DRC. The outbreak has already spread across 20 provinces, a situation never seen before in the country. More than 24,000 people have been affected and 500 deaths have been reported. The World Health Organization, WHO, in August reported up to 1,500 cases. The drought of the recent months and the high mobility of the population in certain areas are said to be responsible for the faster spread and the greater impact, with 28% more cases than in 2016, according to the WHO.
The Doctors Without Borders organization announced that it has launched new activities in the Upper Lomami region in response to the epidemic, while the existing activities in South Kivu have been expanded. Containing the epidemic must be a major priority because with the advent of the rainy season, the spread of the virus can be even faster and lead to a critical situation, said the organization's head of mission in the Democratic Republic of Congo, Cisco Otero.
Todd Phillips is the head Doctors Without Borders, MSF, South Kivu, DR Congo. He joins us now from South Kivu. Thank you very much, Mr. Phillips, for joining us. A response plan was announced by the authorities almost 2 weeks ago. How far has that helped to curb the spread of this disease?
The response plan is being implemented at different levels, but there is a severe lack of funds for most of them. A lot of the response is so far inadequate, as partners and other people have not been able to pick up all that is needed, as it's quite a large outbreak. We are working in 9 provinces, and we have dozens of cholera treatment centers and cholera treatment units open across the country. The focus for us is in the east, where the outbreak is quite bad and we have many regular programs due to ongoing conflict. We've treated over 14,000 cases of cholera, but we really, as a medical organization, are focusing on the treatment and the saving lives of people today.
Are you still recording new cases of the disease, or has the trend lowered?
No, we're definitely still recording cases, all kind of individual pockets, such as in South Kivu, one region in Uvira and Baraka, the rains have started last week, and although cases had started to go down, they have now risen sharply, and we're seeing a doubling and tripling of cases again. So as the rains arrive, we do expect an increase in some areas.
Dr. Phillips, what should be done now to reduce the spread and also in order to save lives, especially in the endemic zone?
Well, the number one preventative measure is clean drinking water and safe latrines. So we're talking about public water systems and many latrines in every home to prevent this transmission. So we really try to focus more on the small-scale prevention of chlorination as well as the treatment of patients now. And we advocate that others, such as the government, other groups who are better at construction, things like this, will take on these larger long-term prevention activities.
We've learned that there are a lot of displaced people living in makeshift camps. How are their plight, and are their plight been minimized in the wake of the outbreak?
Yes, we have many displaced people in the country in many different regions. They are more vulnerable than others. Also, we are seeing many cases in endemic areas as well. So we are appealing to all authorities from all different sides to please put in preventative measures as well as treatment measures for all the displaced people who seem to be the most vulnerable, but as well as the population. This is one of the most severe outbreaks we've had in the last 20 years. Although it is endemic in some areas, this year we have much more of an outbreak in non-endemic areas, which is causing a lot of problems.